Diving into a new study that's done on the disparities of COVID-19 when it comes to kids. Researchers from the CDC looking at Hispanic, African American, and white children and who got the virus and who had to go to the hospital. Carla Navarrete spoke with doctors, educators, and community activists about why these numbers are so different.
Well, the CDC study found that Latino children are 8 times more likely and African American children 5 times more likely to contract COVID-19 than their white counterparts. We spoke to some experts as to the reasons why.
Dr. Eduardo Alcantar has treated COVID-19 patients throughout this pandemic, treating mostly the Hispanic community. When it comes to children and Latinos, he says parents...
I'll try the remedios, I'll try different ways to, take care of my child. And things got in a way, a lot of those remedios do work for, simple diseases. But sometimes when patients or parents, wait for too long period of time is when we see these disasters.
Aside from delaying care, he says Hispanic children have seen a steady rise in obesity. In America, 1 in 5 kids are considered obese, 1 in 4 Latinos.
The rates of obesity have increased, big time.
Assistant Superintendent in a predominantly Hispanic community, Juan Ceja, from the Tolleson Union High School District agrees with what the study found. Latinos and African American parents are overrepresented in those positions deemed essential.
The fact that their parents have these jobs as frontline essential workers, it's going to make everybody else in the household be more susceptible.
Ceja believes the virus attacks regardless of a person's racial composition, but the access to quality health care is where the difference is made.
If their socioeconomic status is lower, they're going to have less access to quality health care.
Janelle Woods, a longtime South Phoenix resident and community activist, says for minority communities, a proactive approach is what's needed.
Show up and get tested when those free testing sites, and I think they're going to stop those here within, shortly. So if you have not taken the time to go get yourself tested as well as your whole family, why don't we do that?
Of the 576 children in the study, according to the experts, the #1 underlying health condition is obesity. In Chandler, I'm Carla Navarrete, ABC 15 Arizona.
Carla.